Aussies spending nearly $1 billion every year on cosmetic surgery, it's got me wondering, are we becoming a makeover nation?
So, I've come to Bondi Beach to conduct an experiment, with help from a few friends.
Could you just tell me where you think the most common spot that a woman would seek surgery?
Oh, for sure, the breasts.
Oh, no hesitation. Right on there.
The bum?
Yep.
I'm thinking thighs and tummy.
Botox around the forehead area.
Noses and lips.
They've hit on the top 3 spots for women: Botox, boobs and thighs. But these days, men are also muscling in on the vanity bandwagon.
Muscle implants in the chest.
Yep, OK.
Abdominal implants. I think probably nose.
In fact, the top 3 procedures for men are man boob reduction, a nose job and liposuction. It seems we all have something we'd consider changing if we could.
Abdominals.
Gut.
Boobs.
Liposuction.
Botox.
Teeth.
The prospect of changing our appearance seems so easy, but do we really give it enough thought? So today, I'm meeting with Talia. She's considering cosmetic surgery, and she's allowed me to tag along to experience the process firsthand.
If there's only one thing that I could change about my body, it would be breast augmentation.
Talia feels that her breasts are too small.
You're given what you're given, but if you can make, you know, slight adjustments into your body shape or the way that you look, then I'm all for it.
Talia's on the verge of making a huge decision, and I want to make sure she's ready for this next step.
So, for you, what do you think will change in your life once you have this procedure?
I guess it's, for me, it's the confidence and the self-esteem. I'm sure it will increase, and that's probably one of the major reasons I'm not having or considering a breast augmentation to look like I have fake breasts. It's just to look natural.
Yeah.
Over the next few days, Talia will be assessed by a plastic surgeon and witness a breast augmentation procedure to determine whether she wants to go ahead.
So how are you feeling?
I'm anxious. I'm nervous.
Yep. What are you most nervous about?
Surgery. Going to sleep and having the procedure done.
So, should we go and see the doctor?
Let's do it.
Let's go.
Dr. Murati carries out more than 50 breast augmentation procedures a year.
So have you ever turned anyone away?
I've turned 3 patients away today.
Today?
Yeah, absolutely. I mean, this is purely elective surgery. So the patient has to be emotionally, financially and physically ready for the operation.
Now, what woman hasn't wondered what a cosmetic surgeon can do for them? So to find out, I'm putting my body on the line.
Now, what about my nose?
You can see here that lower lateral cartilage is a bit misplaced. And you can see the septum herniates into your left nostril. If you required something, you'd only need a tip rhinoplasty.
So far, so good.
You've got fantastic tone to your arms, not much skin sag there as well.
And what about my post-baby belly?
What could you do is a mini tummy tuck. Just a little line across here, a little bit of liposuction here, and also tighten the skin.
So what you're basically saying is that you could give me a six-pack?
I could try. I could draw a six-pack on you. How about that?
Well, certainly food for thought.
I'd actually never considered plastic surgery before, but it really makes you think about all the parts of your body and your face that aren't quite perfect. I really kind of think that the imperfections that I have in my body are part of what makes me me. So would I consider surgery? Not now, but I can't possibly rule anything out.
Now it's Talia's turn. After her physical examination, a 3D scan reveals exactly how her body could look.
So, you want a more natural look?
Yeah, I don't want to look
Yeah.
like I have had a breast augmentation.
So this implant, I think, is sensible for you because it will still give you a natural result, as you can see.
Looks awesome when you can actually see the effects of it.
Yeah. What do you know about breast augmentation?
So far, Talia is quite pleased. But before she commits to the process, we're going inside the operating theatre to witness the next step, a breast implant operation.
You ready?
Yep. Let's go.
Today, Talia and I are taking the next step.
I think Talia's really nervous, and I actually think that this process has been very confronting for her. Talia has an enormous amount of anxiety about what happens on that operating table. She's excited about the process, she's excited about what she's about to see, but let's just wait and see.
And it's not just the procedure that has Talia thinking.
One of the main thoughts that I've been having is, what if I don't like it?
There's a lot of information to take in and synthesise.
That's right.
Before you say yes or no,
Exactly.
isn't it?
And obviously witnessing someone having the surgery done, you get to see what's going to happen to you, possibly.
Do you think you'll be all right?
Are you going to be all right?
Most cosmetic surgeries are day procedures, but they're still invasive surgical operations.
Hello, I'm well. Come on around, I'll get you into your scrubs.
So Talia and I are naturally apprehensive of what we're about to witness.
You ready?
Yep. Let's go.
Dr. Murati says that this procedure takes around 60 minutes to perform. And we've arrived just as he is making his first incision. And it's here that Talia gets her first insight into what she's thinking of putting her body through.
General risk are you're having an anaesthetic, you might have allergies, things like that. Specific to this operation is there's an incision, it's about 4.5, 5 centimetres. That may get infected, very unlikely.
It's major surgery, really. A lot of pushing, poking, prodding. Yep. It's very, very confronting. So you're just making a hole, really.
Yeah, the implant has to sit somewhere.
Yep.
Dr. Murati is making incisions on the underside of each breast where there is a natural fold to insert the implants.
Can I get the forceps, pretty please?
But I'm not sure this experience is what Talia expected.
Okay, I'm sitting down.
You sit down.
Can't watch. I feel like all tingly.
These guys just do this all the time. This is the 4th one today, so it's like just a machine that just keeps going. Really reassuring to kind of see how everyone just seems to move around and know exactly where they need to be and exactly what they need to be doing.
Okay, I'm happy with that.
Yep.
Whose idea was this? I thought it would be you here, not me.
Recovery time for breast augmentation is usually around 1 week, and your doctor will ask you not to exercise for another 6. But now that Talia has seen firsthand what she could be in for, what does she think?
Now I kind of feel that, do I really need to go through this?
Okay.
There's a lot of questions you need to ask yourself, whether this is something that, you want to do, whether you want to go through the procedure,
Yeah.
or whether you just be happy with what you've got.